Diseases of Ear, Nose and Throat and Head and Neck Surgery by P.L.Dhingra. Anatomy of Ear, the middle ear. The middle ear, together with the estriation tube, adductus, antrum, and mastoid air cells, is called the middle ear cleft. It is lined by mucous membrane and filled with air. The middle ear extends much beyond the limits of tympanic membrane, which forms its lateral boundary and is sometimes divided into mesotympanum lying opposite the pars tensa, epitympanum at the attic lying above the pars tensa but medial to Schaffner's membrane and the bony lateral attic wall. The hypotympanum lying below the level of pars tensa. The portion of middle ear around the tympanic orifice of the estriation tube is sometimes called the protympanum. Middle ear can be likened to a six-sided box with a roof, a floor, and medial, lateral, and anterior and posterior walls. The roof is formed by a thin plate of bone called tegmen tympani. It also extends posteriorly to form the roof of the adductus and antrum and is called the tegmen antri. It separates the tympanic cavity from the middle cranial fossa. The floor is also a thin plate of bone which separates the tympanic cavity from the jugular bulb. Sometimes it is congenitally deficient and the jugular bulb may then project into the middle ear, separated from the cavity only by the mucosa. The anterior wall has a thin plate of bone which separates the cavity from the internal carotid artery. It also has two openings, the lower one for the estriation tube and the upper one for the canal of tensor tympani muscle. The posterior wall lies close to the mastoid air cells. It presents a bony projection called the pyramid, through the summit of which appears the tendon of stapedius muscle to get attached to the neck of stapes. And it is an opening through which the attic communicates with antrum lies above the pyramid. Facial nerves runs in the posterior wall just behind the pyramid. Facial recess or the posterior sinus is a depression in the posterior wall lateral to the pyramid. It is bounded medially by the vertical part of the cranial nerve 7, laterally by the chorda tympani, and above by the fossa inquidus. Surgically, facial recess is important as direct access can be made through this into the middle ear without disturbing the posterior canal wall. Here we can see the walls of the middle ear and the structures related to them. One is the canal for tensor tympani. Two is the opening of the estriation tube. Three is the oval window. Four is the round window. 5 is the processus cochleaformis. Horizontal canal is 6. 7 is the facial nerve. 8 is the pyramid. 9 is the adductus. 10 is the chorda tympani. 11 is the carotid artery. 12 is the jugular bulb. This is the anterior, this is the medial, this is the posterior, and this is the lateral wall. This is the floor, and this is the roof. So here we can see the middle ear cleft. Estriation tube, attic, middle ear, adductus, antrum, and mastoid air cells. Here we can see the divisions of the middle ear into epi, meso, and hypotympanum. Here we can see the lateral attic wall or scutum, pars flaccida, pars tensa, hypotympanum, mesotympanum, and epitympanum. Figure 1.10. A. The facial recess lies lateral and sinus tympani medial to the pyramidal eminence and vertical part of the facial nerve. This is the chorda tympani. This is the cranial nerve 7, pyramid, sinus tympani. This is the stapes. This is the facial recess. B. Exposure of facial races through the posterior tympanotomy as seen at mastoid surgery in the semicircular canal. Here we can see the incus, horizontal semicircular canal, posterior tympanotomy, chorda tympani, cranial nerve 7, and round window. So, surgically, facial recess is important as direct access can be made through this into the middle ear without disturbing posterior canal wall. Intact canal wall technique, and it is also the route of insertion of electrode of the cochlear implant. The medial wall is formed by the labyrinth. It presents a bulge called promontory, which is due to the basal coil of cochlea, oval window into which is fixed the footplate of stapes, round window of the fenestra cochleae, which is covered by the secondary tympanic membrane. Above the oval window is a canal for facial nerve. Its bony covering may sometimes be congenitally dehiscent and the nerve may lie exposed, making it very vulnerable to injuries or infection. Above the canal for facial nerve is the prominence of lateral semicircular canal. It just anterior to the oval window, the medial wall presents a hook-like projection called the processus cochleariformis. The tendon of tensor tympani takes a turn here to get attachment to the upper part of the handle of malleus. The cochleariform process also marks the level of the first genu of the facial nerve and is an important landmark for surgery of this nerve. Medial to the pyramid is a deep recess called the sinus tympani, which is bounded by the subiculum below and the ponticulus above. The lateral wall is formed largely by the tympanic membrane and, to a lesser extent, by the bony outer attic wall called scutum. The tympanic membrane is semi transparent and forms a window into the middle ear. It is possible to see some structures of the middle ear through the normal tympanic membrane. Example, the long process of incus, incudiostepidial joint, and the round window. Mastoid antrum. It is a large air containing space in the upper part of the mastoid and communicates with the attic through the adytus. Its roof is formed by tegmen antri, which is a continuation of the tegmen tympani and separates it from the middle cranial fossa. The lateral wall of antrum is formed by a plate of bone which is on an average 1.5 centimeter thick. So here we can see in figure 1.11a that the medial wall of middle ear. 1 is the promontory, 2 is the processus cochleariformis, 3 is the cranial nerve 7, 4 is the oval window, 5 is the horizontal canal, 6 is the pyramid, 7 is the ponticulus, 8 is the sinus tympani, 9 is subiculum, 10 is the round window, 11 is the tympanic plexus. Section B, section through the temporal bone showing structures of medial wall of middle ear. Note the relationship among the oval window, round window, and tympanic segment of facial nerve. Here we can see the oval window, tegmen tympani, promontory, round window opening, facial nerve, horizontal canal opening, and superior semicircular canal. The lateral wall of antrum is formed by a plate of bone which is on an average 1.5 centimeter thick in adults. It is marked externally on the surface of mastoid by suprameatal McEwen's triangle. The lateral wall of the antrum is very thin at birth, about 2 millimeter, and then increases in thickness at a rate of 1 millimeter per year till it is 12 to 15 millimeter in an adult. Also remember that the supramastoid crest roughly corresponds to the floor of the middle cranial fossa. Adytus adantrum. Adytes is an opening through which the attic communicates with the antrum. The bony prominence of the horizontal canal lies on its medial side, while the fossa inquidus, into which is attached the short process of incus, lies laterally. So in figure 1.12, we can see the McEwen's triangle or McEwen or suprameatal triangle. It is bounded by the temporal line, also called the supramastoid crest. This is the temporal line shown in A. Then posterior superior segment of bony external auditory canal. This is B. And the line drawn as a tangent to the external canal. That is a C. It is an important landmark to locate the mastoid antrum in the mid-ear surgery. Here we can see the spine of Henle, which is the landmark. Figure 1.13, air cells in the temporal bone. The tip cells are named according to their location. So this is the temporal bone. This is the squamous part, zygomatic, petrous. Okay. So we can see the tip cells, mastoid tip cells. These are the peritubal cells, petrous apex cells, zygomatic mastoid antrum, squamosal, synodural angle, periantral, perisinus, retrofacial, marginal cells. The mastoid and its air cell system. The mastoid consists of bony cortex with a honeycomb of air cells underneath. Depending on the development of air cells, three types of mastoid have been described: well pneumatized or cellular. Mastoid cells well developed and their intervening septa are thin. Diploitic. Mastoid consists of marrow spaces and few air cells. Sclerotic or acellular. There are no cells or marrow spaces. With any type of mastoid pneumatization, antrum is always present. In sclerotic mastoids, antrum is usually small and the sigmoid sinus is antepost. Depending on the location, mastoid air cells are divided into zygomatic cells in the root of zygoma, tegment cells extending into the tegment tympani and tegment antri, perisinus cells overlying the sinus plate, retrofacial cells around the facial nerve, perilabyrinthine cells located above, below, and behind the labyrinth. Some of them pass through the arch of superior semicircular canal. These cells may communicate with the petrous apex. Peritubal cells around the estriation tube, along with hypotympanic cells, they also communicate with the petrous apex. Tip cells, which are quite large and lie medial and lateral to the digastric ridge in the tip of mastoid. Marginal cells lying behind the sinus plate and may extend into the occipital bone. Squamosal cells lying in the squamous part of the temporal bones. Figure 1.14, corner's septum as seen on mastoid exploration. A. In coronal section of mastoid. Here we can see the corner's septum. B. In its presence, it's a coronal section. In its present, it's difficult in locating the antrum which lies deep to it. So this is a squamosal cell, petrous cells, and antrum. This is a pneumatized petrous apex. In middle ear infections, abscesses may form in relation to these air cells and may sometimes be located far from mastoid region. Development of mastoid. Mastoid develops from the squamous and petrous bones. The petrosquamosal suture may persists as a bony plate, the corner's septum, separating the superficial squamosal cells from the deep petrosal cells. Corner septum is surgically important as it may cause difficulty in locating the antrum and the deeper cells and thus may lead to incomplete removal of disease as mastoidectomy. Mastoid antrum cannot be reached unless the corner septum has been removed. Petrous apex and its air cell system. The petrous apex lies anterior and medial to the labyrinth. It may be pneumatized in 30% of individuals with cell tracts running either from mastoid or the hypotympanum. They run inferior, superior, or anterior to the bony capsule of the labyrinth and cochlea. Ossicles of the middle ear. Figure 1.16. Ear ossicles and their parts. This is the malleus, this is the incus, and this is the stapes. So in the malleus, we have head of malleus, neck, anterior process of malleus, lateral process of malleus, handle of malleus. That's it. Then in incus, we have a body of incus, short process of incus, long process of incus, and a lenticular process. Then under stapes we have head of stapes, posterior crus and foot plate. Anterior crus and posterior crus, head of stapes and foot plate of stapes. Ossicles of middle ear. There are three ossicles in the middle ear: malleus, incus, and stapes. The malleus has head, neck, handle, which is manubrium, a lateral and an anterior process. Head and neck of malleus lie in the attic. Manubrium is embedded in the fibrous layer of the tympanic membrane. The lateral process forms a knob like projection on the outer surface of the tympanic membrane and gives attachment to the anterior and posterior malleal folds. The incus has a body and short process, both of which lie in the attic, and a long process which hangs vertically and attaches to the head of stapes. The stapes has a head, neck, anterior and posterior crura, and a foot plate. The foot plate is held in the oval window by an annular ligament. The ossicles conduct sound energy from the tympanic membrane to the oval window and then to the inner ear fluid. Intratympanic muscles. There are two muscles, tensor tympani and stapedius. The former attaches to the upper part of the handle of malleus and tenses the tympanic membrane, while the latter attaches to the neck of stapes and helps to damper very loud sound, thus preventing noise trauma to the inner ear. Stapedius is a second arch muscle and is supplied by a branch of cranial nerve 7, while tensor tympani develops from the first arch and is supplied by a branch of mandibular nerve. Tympanic plexus. It lies on the promontory and is formed by tympanic branch of glossopharyngeal and sympathetic fibers from the plexus round the internal carotid. Tympanic plexus supplies innervation to the medial surface of the tympanic membrane, the entire tympanic cavity, mastoid air cells, and the bony estriation tube. It also carries secretomotor fibers for the parotid gland. Section of tympanic branch of glossopharyngeal nerve can be carried out in the middle ear in cases of Freyer syndrome. Course of secretomotor fibers to the parotid. Inferior salivary nucleus, cranial nerve 9, tympanic branch of cranial nerve 9, Jacobson's nerve, tympanic plexus, lesser petrosal nerve, aortic ganglion, auriculotemporal nerve, and parotid. Coda tympani nerve. It is a branch of the facial nerve which enters the middle ear through posterior canaliculus and runs on the medial surface of the tympanic membrane between the handle of malleus and the long process of incus. Above the attachment of tympanic tendon of tensor tympani, it carries taste sensation from the anterior two-thirds of the tongue and supplies secretomotor fibers to the submaxillary and sublingual salivary glands. Lining of the middle ear cleft. Mucous membrane of the nasopharynx is continuous with that of the middle ear, adytus, antrum, and the mastoid air cells. It wraps the middle ear structures, the ossicles, muscles, ligaments, and nerves, like peritoneum, wraps various viscera in the abdomen, raising several folds and dividing the middle ear into various compartments. Middle ear contains nothing but air. All the structures lie outside the mucous membrane. Histologically, the estriation tube is lined by ciliated epithelium, which is pseudostratified columnar in cartilaginous part, columnar in the bony part with several mucus glands in the submucosa. Tympanic cavity is lined by ciliated columnar epithelium in its anterior and inferior part, which changes to cuboidal type in the posterior part. Epitympanum and mastoid air cells are lined by flat, non-ciliated epithelium. Blood supply of middle ear. Middle ear is supplied by six arteries, of which the following two are the main ones. Anterior tympanic branch of maxillary artery, which supplies the tympanic membrane. Stylomastoid branch of posterior auricular artery, which supplies the middle ear and mastoid air cells. Following are the four minor vessels. Petrosal branch of middle meningeal artery runs along greater petrosal nerve. Superior tympanic branch of middle meningeal artery traversing across along the canal for tensor tympani muscle. Branch of anti artery of pterygoid canal runs along the Eustachian tube. Tympanic branch of internal carotid. Veins drain into pterygoid venous plexus and superior petrosal sinus. Lymphatic drainage of ear. Lymphatic drainage of ear is shown in table 1.1. The inner ear does not have any lymphatics. Lymphatic drainage of ear. Area. Concha, tragus, fossa triangularis, and external cartilaginous canal. Preauricular and parotid nodes. Lobule and antitragus. Infraauricular nodules. Helix and antihelix. Postauricular nodes, deep jugular and spinal accessory nodes. Middle ear and Eustachian tube. Retropharyngeal nodes, upper jugular chain. Inner ear, no lymphatics. Thank you.